How are you doing today?
Oh, I'm doing wonderful, Donna. Thank you so much for having me.
Absolutely, absolutely. And you said you're in California, right? The West Coast. How's that looking right now?
Oh, it's beautiful. It's California, so it is a wonderful place to live. We're actually on the Central Coast, so right 3 hours south of San Francisco, 3 hours north of LA. So kind of strategic, but also beautiful.
Oh, I'm from Jersey right now between the weather and everything. Oh, I am a little envious, but all good. But welcome. Thank you for joining our webinar today. But before we dive in, I would love to hear a bit about yourself, your background, Austin.
Yeah. Um, well, I was very fortunate to start my career at Apple. I was there about a year after Steve Jobs was let go or fired, I guess. And then I left actually the day he came back. And after 10 years of working there, I had actually worked with many of the people from the books and the movies, and not a lot of people were thrilled. So I kind of took an opportunity to go from Apple over to Palm Computing. Um, but I like to talk about my time between those two companies, and as it sort of pertains to healthcare, because it really honed my skill set about taking really complicated technologies and turning them into solutions that anybody can use. Um, I was After Palm, I started a company called Experts Exchange. It was the largest knowledge sharing community in the world. We were spearheaded a SaaS model. We also just was it was an amazing business. I was able to have a eight-figure exit, got to retire at 40, which was a lot of fun. And actually during that time, my wife and I, started to wanted to get involved in our community because we live in a fairly small town, and having this nice exit and being responsible for 2, 3, 4 million people, members, right? But not being connected to where we live. So we got involved. We started a surf and skate shop because we wanted a place for kids to come and be able to hang out. And I tell this because it really is how we got started on this journey of how do we make a difference with mental health, specifically for kids and families, and then even more specifically for low income, the Medicaid population in California, where we are, where we're starting. It's called Medi-Cal. But my background is very eclectic, and I've been very fortunate and very excited to be able to share what we're doing and see who gets excited about it. As part of sharing who I am, the other thing that I like to share is if anybody that gets to watch this and has a need around products or connections or whatever, I've had so many people invest in me. If I can be a help to the venture that you guys are working on, I'd love to be hit up on that. So hopefully there's contact information that anybody can follow up with.
Amazing. I love that, Austin. And I love the background. I also love how after you retire, you didn't stay retired. You pivoted to create positive social impact. So that brings me to really the big question. Tell me a little bit about Esteem Health. What inspired you to create it? We heard a little bit there, but I'd love to learn more.
Yeah, well, it really came out of being, getting involved in the community. And with the surf and skate shop, we started working, interacting with kids and families, and just seeing how difficult it was for some of these families. We ended up sort of pivoting the point of the surf shop, and really had it be more of a almost a social center, where the young adults that we hired were more than just there to sell Billabong and Volcom and whatever. They were there to interact with these kids. Um, and so that really, I finally said to my wife, "I'm going back to work." And she looked at me and goes, "Why would you go back to work? You did it. You retired." And I said, "I have to. I operate at a very high level within chaos and new things." And she literally said,
I
"You have
love
a
that.
problem." I said, "Yeah, I have a problem." But but really, I just couldn't. The thing that I credit Apple for is it was so inspirational to be a young man in the beginning of my career and changing. We can change the world on a on a micro and a macro level. And it just kind of seared into my DNA, and that's how I look at life and how I look at the purpose. one of these people that feel like you have one chance to go around, and why not make the biggest impact?
Amazing. And I cannot relate to something more than that. I myself thrive in chaos and I don't know what about chaos it is, but somehow that's when I do my best work. Um I love that though. Now, with healthcare, we're all aware there's so many challenges, right? What specific challenges is Esteem Health addressing when it comes to healthcare?
Yeah. Well, I mean, specifically, we're really it's mental health for us. That's the tip of the spear that we're using to really inter interject innovation into these lives that typically don't get an opportunity for innovation. I know that might sound like a strange place to start, but the Medicaid budget is about $607 billion, and the population that we go after is 5 to 30. We started 5 to 18, but then realized sort of failure to launch. We needed to increase it up to 30. Um, but what we've noticed was just obviously there's an access problem. There is a need to have more providers, but when things aren't really aligned for improved outcomes, that's where I really started to say, wait, this is there's an opportunity to do something different, right? And in fact, when we started looking at the CPT codes on how you get reimbursed, I was looking at, I'm looking for a specific one, and then I'm realizing they're not actually these people, the entire system's geared towards reimbursement, not towards improved outcomes. And so what we decided to do was really bring a data-driven approach to mental health services that drives innovation so that we can actually get to a place where we can have predictive medicine. And when I say we're talking about telehealth, we're actually telemedicine in that we have a pediatric psychiatric practice. And from the outside, it looks like we're trying to compete, provide these services, but ultimately we're operating at a much higher level in that we're aiming to have predictive SDOH, social determinants of health, predictive medicine, where that we might have an inner city mom, 3 kids, 3 dads, insecure housing, no concept of nutritional food or parenting skills. How do we use the opportunity of mental health? And again, this huge budget of 600 and whatever billion, for the age group that we're talking about, it's about 175 billion is what we think. But the money is there, but what's not there is how do we align the services, the pay, but to outcomes. And so for us, this isn't a arbitrage, of generating more revenue through efficiencies because of technology. This really is a how do we bring this predictive medicine model so that we can have a really good handle on how do we take the gal that I mentioned from chaos to stability, but then from stability to thriving. And then ultimately our how we think we win is seeing families actually exit being dependent upon the Medicaid Medi-Cal space. And we've done 10,000 plus sessions as a practice, worked with 600 plus families. It's an N of 5, but we've helped 5 families move from being on the Medicaid platform for many years to actually working. And so for us, we think that there is a really big win there, not just in terms of impact, but actually building a business that does focus on outcomes that again drives innovation into the space. And I'm sure we'll get into more of, like, what that means.
Amazing. I love that this is such a different concept from a lot of things that we typically get into, right? A lot of our sessions are based on, like, say, real estate, cryptocurrency, private equity, and today we are in this mental health care space. It's very fascinating and intriguing, and also you've made it looks like a very remarkable business model out of it. Tell me, how has your background in technology helped you just leverage that in telehealth, the technology to make this healthcare more accessible to the public, especially the public that will not have access to this otherwise?
Yeah. Yeah, well, I guess with my background, again, it's having the ability to believe and imagine things that are completely out of my control, and even just okay, this sounds too much. This is too big. But to start the product, to start and see what we can do with it. So I hate to say that I'm fearless, but but essentially as an entrepreneur, you kind of have to be, right? And for us, we're by the way, we're all in on this. This is so important to myself, my family, that our team is that we burned the boats. We're all in on doing this. But what's really interesting to me is not having originally not having a healthcare background and then walking into the space
Okay, I
and
found this on the web for healthcare background.
sorry, I was trying to turn that off. Um, Not having a healthcare background and but having enough elbow room to kind of say this, why does this not make sense? Why does it work this way? And we've through our process, which has been very methodical. We are old school entrepreneurs where we see a big problem and we're going to chip away at it. This isn't about failing fast because this isn't about monetizing eyeballs. But I get to bring all of this consumer focused experience, all of how do we actually treat low income families like they're real consumers, as opposed to beneficiaries of something that they're entitled to. This really is our approach. Really is different, and it's it's making a difference in so many families right now.
And I can also see when you're speaking about it, you speak with so much passion and enthusiasm that really shows, not just to me, I'm sure everyone who's just listening in today, how passionate you are and how invested you are in this. You keep bringing up a few words that I just noticed: data driven, predictive medicine. Tell us a little bit about how can data driven insights and predictive medicine actually improve patient outcome? Because I'm curious myself.
Yeah. Well, the short answer is insights and inherence. And so when you so our process before we were Esteem Health, we were Esteem Therapeutics, and we went out after this with a direct to consumer approach where we developed a platform and created an app for parents to manage their kids' social, emotional, mental, behavioral health. And the way we use data there is we fully consumerized, scientifically validated, and clinically used tools that in the hands of the parent, we're able to just interview them and pull this data. And this data in the hands of the clinician is able to do a full psychiatric evaluation. In the hands of parents, it's insights. And so for the first time, they get to go beyond this idea of, well, I guess Johnny just got diagnosed with ADHD and kind of has a label, and I don't know what to do because this is new. And I'm kind of like now heading in a direction that I just, I don't know what to do. My pediatrician has 45 people in the waiting room. I'm not going to get the 45 minutes I need to understand this from them. So with data, we're able to take let's call ADHD, and we were able to break it down into being able to see that maybe this child had clinically severe focus issue, and then maybe clinical but moderate impulse control, which would be a behavior issue, and then whatever indication of anxiety, depression. But with this insight of understanding what these things are and data, we were able to then create using machine learning, which falls under the umbrella of AI. I tried not to overemphasize AI. AI is important. It's coming. It's going to be part of this, but our opportunity with some of these technologies is to do it very smart and very uh, um, there's just a lot of things going on where we have to make sure that we go through the process correctly before we just start making throwing AI bots everywhere. But with the data, and then this machine learning that created an improvement goal, they were able to look at the different things going on with their child. We asked them, which would you like to work on first, focus or behavior? And in the many times that focus might have been a bigger issue, but behavior had a more impact, had more of a bigger impact in the family. So what did data do? Data gave them the opportunity to understand and then make a choice. And the data, which again didn't exist until we were able to really help them understand this, to now have a goal. We have a baseline and we have an improvement goal, and then our technology has these micro steps between where they're starting and where they're heading, and then being able to choose an intervention to be able to address that need. And the intervention could be medication, it could be meditation, it could be journaling, it could be a whole bunch of different things. But to try to keep these my answers short, which I have a very difficult time doing,
I love
uh,
it. I love it.
I appreciate that. I really do. Is uh, um, is that the data illuminates, and then a data. Imagine. Oh, I'll just speak for myself. So in July, I maxed my weight at 245. I'm 5'6", so I'm a short guy, so I was miserable, and so I started my, actually started a carnivore diet, which really is working out great for me. I lost 35 pounds, but the point is if I didn't have this data, how would I know? And really, even in the last month, it feels like nothing's like I'm stuck. But the data shows I'm losing half a pound a week, and I'm okay with that, right? I don't need to make the change to try to get back to the 2, 3 pounds. And so, but where is that for mental health? How do we actually know where we make improvements? And so it's not only important for us to be able to understand that, to choose our own path, to be able to be part of the process, because we really help parents or caregivers be part of the process. So I talked to a bunch of different CEOs that I periodically meet with, and it's like, hey, how do we get patients to adhere? Well, when they're involved, they're automatically participating and adhering to whether the medication or the mental health uh, suggestions and things that our providers are going through. But really having that the data and it makes all the difference, really.
I would absolutely agree. And I feel like ever since 2020 and everything became more telehealth and there's so many apps out there I feel like I've seen regarding mental health, data has become more prominent. So data is definitely important, especially in anything. In the investing industry, finance industry, in healthcare, data is important. Now, that's I feel like that's one of the main components that sets Esteem Health apart. What else do you think, Austin, that sets you guys apart, especially in this holistic, family-centered approach you have towards healthcare?
Yeah. Well, this may not be one of the things that set us apart, but I do want to sort of set the understanding that, right now we really are, we're not worried about our profitability. We're not worried about EBITDA. We're not worried, again, about how to maximize a telehealth um, business model. What we're actually trying to do is build this data-driven treatment plan, care model, so that when we are able to get to that place I just talked about, where a parent gets to choose what they want to work on, one of the things that makes us different is that we have a pipeline of those digital health apps that you're just talking about, right? And for middle to upper income, there is no, really is not a much of a barrier. That population typically, 2, 4, 5 apps a month. It doesn't really matter if it's a $5 subscription, but these amazing digital health apps are to low income families are kind of behind this app store paywall. So we'll actually pay for this. So if our provider is working with maybe a 13-year-old girl, and journaling would be something that could be really effective, then we'll actually partner with a journaling uh, app company connected to our platform, have our providers uh, clinically recommend, as much as I want to say prescribe, and we'll get there, but clinically recommend, our providers now can offer this to this 13-year-old and free of charge. We get to collect the data on how that impacts the care model, so that ultimately when we start to look at working with different populations, we can say when we do the therapy, when we at whatever cadence, when we provide this type of support, when these digital apps are brought together, when there's more support, again, what makes us different is we go beyond just addressing the access issue, which for us, access, it's 48 days on average for anybody, let alone low-income families, to receive mental health. We do same-day service. Same day service because that's what's needed. It's not because we're trying to win through a marketing scheme. There about 50% of the families will disappear after 72 hours if we don't engage with them. And it's not because they found another provider. It's because something else blew up in their life. So if we're serious about making an impact, right? The approach that makes us different, again, is being able to bring in these digital health apps that, again, are data rich. And going back to that example, now imagine when the provider who's assigned or recommended the journaling app gets to see in our proprietary platform. We don't use off-the-shelf EHR. We created a we created our own platform because it's more workflow. There's been too many instances where pediatricians spend 1 to 4 hours a night feeding the EHR when it's supposed to be helping them. And so our workflow allows them to have the data in vivo. And so if this gal had been journaling for 3 of the 5 days that she was trying to, we can see how she's doing. We can have a little AI module, which there would be appropriate, that summarizes, oh, she had a great week. Like, and here's some points, right? Without having our providers
Mhm.
having to go back and read through, what all the text and the context, and so that's just sort of a glimpse of what makes us different. And we do that again, going back to my statement a few minutes ago, of we're not worried about, trying to maximize a profit center. We can operate at a 60 plus margin. I know there's a lot of people that are familiar with mental health and Medicaid are gonna be like, no way. I can demonstrate exactly how we do that. But being able to drive the innovation through just common sense approach. Again, wouldn't it make sense for somebody who works with families to not close at 4:30, but instead have the same day service? And then after, and we built a team around the family, which makes us different. It starts with a evaluator, so we do a psychiatric evaluation, and then they work with the care coordinator. And when they work with the care coordinator, we ask them what day works best for you for ongoing. And these folks, and I'm not throwing anybody under the bus, everybody's doing the best job they can, but many times it feels more like a DMV experience where they're getting this line, your next appointment's in 3 weeks at 2 p.m. on and it's like no consideration. We simply say, what what day works best? Thursday, great. What time of day? And they always kind of sheepishly go, after school, sure, 2, 3, 4, 5, 6, 7, 8, 9 weekends, because we're here to service this group. And because of our approach, we have a waiting list of providers that want to come work for us. Because that's one of the questions, right? Well, how are you addressing the shortage? Well, 80% of therapists in the US don't take any insurance. It's because they're just so tired of having to go through that process. And you go to these websites and they charge 180, $280 an hour. But if you ask, you put 50 in a room and you ask, raise your hand if you went into this to make money, nobody raises their hand. They always say it's because I wanted to give back. I either went through something, or somebody in my family went through something, or I felt called to this. Well, then they get out in the real world and it's hard as hell to have a 1, 2, 3, 4, 5 person practice taking any insurance. We take care of all that. So we're pulling from this 80%, our hook is, who do you want to serve? I want to serve families. Great. Where? I'm actually from Riverside, and it's kind of low income there. Can we serve? Yeah, of course. Yeah, because we in California is where we started, and we've got managed care contracts, about 9 or 11 fully executed, which gives us the opportunity to work in most of the state. So we're able to do the work that these providers just don't have time to. And we do all their billing, we do all the compliance, we do all the contracting, we pay them, whether a patient shows up or not, we pay them top dollar. We really do, we really are looking at each sort of value, each level, and how can we drive more value, right, into the system. So we're elevating providers, especially associates, right? We're elevating the supervisors. We're elevating, even working with pediatricians, right? It's again not coming from healthcare and walking to pediatrician's office. And I'm very trying to be very humble to say, I know you guys know everything about mental health, and it turns out they don't. They really don't. It's not that, and they're not hiding it. It's just there's so many other things they have to focus on. And so for us, well, how do we provide more value to them? Right. And so, as a technology company, as a problem solver, as a solution, and really a value driver, the difference, for us is how do we elevate as much as we can so that we can grease the skids to collect the data, to remove the friction points, and to just provide them like if we were a private Beverly Hills practice, and just treat them extraordinary.
Amazing. What I'm really hearing is you've created a very innovative data-driven approach to really impact such a positive social change on low-income families that really need it, that if not otherwise couldn't afford it. And on top of that, you've also found a solution to some of these service providers that, by the sound of it, it looks like they were suffering too. They were struggling too because they wanted to really help, but they got stuck in that whole insurance
Mhm.
vicious cycle. So you really created a company that provides solutions to all sides of the coin. Austin, that's very impressive. Now, I love to hear more, but we are nearing our time. Before we open it up for questions, I want to hear from you because I'm sure. Tell me a success story. What is that one success story that you're so proud of that you've been able to just witness?
Yeah, yeah, I was trying to come up with a few, and honestly, it really is every day. And I don't mean to not answer that directly, but when we are, and by the way, again, being old school, I spent 3 months as a CEO answering the phone because I wanted to experience that. And the first thing is when a mom is at their wits' end. And I've been the school is asking me to do this, and I don't know what to do, and we say, "We got you." Just the I mean, I mean, I could tell you about the suicidal ideations that we prevented. I could tell you about the 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 amazing work with foster that we're doing, or kids that we're working with the California court system with a alternative to incarceration. We have 25 people now, right now. Have been recognized in getting a 1.14 million dollar grant from California as part of the ECM program. There's so many success stories, but it starts with the moment when you tell a struggling mom, "We got you," right? And then we follow through. And then, it every day that breathes life, we've got about 30 plus, providers, 6 prescribers, kinda all over the state, in other parts in as well as, parts of the US. Work with a small team, but probably once or twice a day, somebody barges in my office and said, "You won't believe what just happened." And so it just imagines some of the worst, from finding an older brother expired from an overdose, and how do we walk a family through that, to other death and tragedies and unspeakable things, for us to be there. And when I say us, our providers are amazing. We really go through a process of really, are you fit? Are you here to serve this community? And so, yeah, I wish, as much as I want to do a big heartstring thing, it's really every family and every moment we're providing something that to them feels life changing.
And I think I truly appreciate that answer because everything what I'm hearing is every single day you guys are making a big difference that's much needed in this world.
Awesome. Well, I so appreciate the opportunity to share. I know that there are people that are considering, people that have invested in other things. If you're all considering, please reach out. We've actually reached 750,000 of our million raise. We'd love to oversubscribe, honestly, and especially if you're just an investor, awesome. But if you're somebody who's passionate and want to be part of our advisor committee, of our community, that would be awesome. So I look forward to any conversations that may come out of this. Again, if I can be a support to something that you're working on, I will absolutely do my best to see how I can help.